Please subscribe to my channel and do hit the bell icon. Next, we shall check out cardiac arrhythmias occurring due to impulse generated from an abnormal site. Now we know SA node is a normal pacemaker of the heart, but suppose due to some disease the SA node got damaged, then the impulse generation task will be now taken up by the AV node. So AV node will get a chance to express its automaticity. But when SA node stops working, there will be a pause, and after that pause this AV node will start producing the automaticity. When AV node becomes the pacemaker, it is known as nodal rhythm, and this condition is known as sinus arrest followed by nodal escape rhythm. These statements only explain the entire condition. The SA node has stopped working, so sinus arrest, then there will be a pause, and then there will be a nodal rhythm. So sinus arrest followed by nodal escape rhythm. Similarly, sometimes the AV node fails to work because of some damage or because of some infarction. So what will happen now? The SA node will be firing at a normal rate, but AV node fails to conduct the impulse to the lower part of the heart. Under this condition, the purkinje system will become free from the overdrive suppression and it will start producing the automaticity. So this condition is known as nodal arrest followed by escape rhythm of purkinje system. Here SA node will be producing beats 70 to 80 beats per minute, but the purkinje system will be firing at the rate of 30 to 40 beats per minute. Therefore, on ECG you will find 80 P waves and 40 QRS complexes. So, in a cardiac arrhythmia, abnormal site may be AV node or the impulse generated from the AV node or the impulse generated from the purkinje system. But sometimes what is seen is that even few atrial cells or ventricular cells are producing impulses. Yes, you heard it correct. Till now, we know atria and ventricular cells only conduct the impulses, but there are certain circumstances or you say certain pathological condition in which these non-pacemaker cells, that is the atrial and ventricular cells, also start generating the impulses. So, impulse generated from atria and ventricular cells, this is known as triggered automaticity. Now let us learn something about this triggered automaticity. Now suppose this is your heart and this is a ventricle and a cell of the ventricles in which this cell is a defective cell. So as such, this defective cell is sitting quietly without producing any disturbance in the functioning of the heart. But what happens, when the impulse are generated from the SA node, it is transferred or conducted to the AV node and then to the purkinje system to the entire ventricles. And when this normal impulses, when it approaches to this defective piece of the ventricle, it will start producing automaticity. So this is known as triggered automaticity. So as such, this defective cell was sitting normally without producing any problem, but when normal impulse approaches to this defective cell, it will start producing a triggered automaticity. A very simple example is, suppose this dog is a defective cell which is not producing any kind of problem, but when a normal impulse approach it, it will start producing a triggered automaticity. Similar situation is over here. Defective area in the heart normally does not produces any action, but when normal impulse approaches it, it starts producing a triggered automaticity. So this defective ventricular cell will zoom and we'll see what exactly happens. First of all, we'll see the normal cell physiology and then we will check out the defective cell pathophysiology. So normally the cell will be under a resting membrane potential, and when it receives the impulses it will undergo depolarization. Depolarization means when the sodium channel will be open, that is the voltage gated sodium channel opens, leading to depolarization. Once depolarization has occurred, this voltage gated sodium channel will close and repolarization occurs because of opening of the potassium channel first and causing outflux of potassium ion. Simultaneously, calcium channel also opens up, causing influx of calcium ion. So outflux of potassium and influx of calcium, outflux of cation and influx of cation, because of which a plateau will be attained. And after some time this calcium channel also closes and only potassium channel will be open, causing outflux of the potassium ion, leading to repolarization. The membrane is brought back to the resting stage. Okay, resting stage. Next, when another impulse is been approaching to this ventricular cell, it will undergo depolarization, again repolarization, and the resting stage. Again an impulse got conducted over here, leading to depolarization and then repolarization. So this is what normally happens in a normal cell. Now we are talking about a defective cell. So when a defective cell receives an impulses, what will happen? As this is a defective cell, it receives the impulses. First of all, it will be at a resting state. After receiving the impulse, it will undergo depolarization and then repolarization. When it was going to repolarization stage, and another upstroke, a secondary upstroke may occur. So this is one possibility of a defective cell. This yellow wave is a secondary upstroke, or you can say a secondary depolarization. This is one chance. This is one possibility. Another possibility is this blue wave. This is also a kind of secondary upstroke. This yellow wave occurred before repolarization was completed. So repolarization was partly completed and a secondary depolarization occurred. So that is the yellow wave, and this blue wave, it has started after completion of this repolarization. So this blue wave and this yellow wave, this extra waves, what you can see over here, this is known as after depolarization. This yellow wave, what you can see, it has been occurred before repolarization has been taken place completely. So this yellow wave is known as early after depolarization, and this blue wave, what you can see, it has occurred after complete finishing off of the repolarization. Therefore this is known as delayed after depolarization. So after depolarization is nothing but it is an extra or a secondary or an unplanned depolarization that has been taking place. And after depolarization are of two types, that is early after depolarization and delayed after depolarization. So normally what was expected? First of all, a primary depolarization should occur. This primary depolarization is followed by a primary repolarization. After completion of this primary repolarization, there should be a resting stage, and after completion of this resting stage, and another primary depolarization should take place. Okay, so this is what normally is been expected. But what has happened over here? Here you can see a secondary depolarization has been taken place, which is abnormal. So this secondary depolarization, what has taken place, is known as after depolarization. Since primary depolarization is triggering this extra abnormal depolarization, name given as they are produced after a normal primary depolarization. Now this early after depolarization, here what happens is the cell has still not completely repolarized and a secondary depolarization has occurred, therefore the name early after depolarization. Whereas in case of delayed after depolarization, here primary depolarization has completely occurred, even primary repolarization has completely occurred, but the cell has fluctuating resting state and it may touch the threshold point to produce an extra unwanted unplanned depolarization, that is your delayed after depolarization. Next we'll check out about the early after depolarization.